question, one follow-up. We have Dr. Moore here today, so I'll turn it over to him for some brief remarks.
Good afternoon, everyone. Today, there are 486 new cases of COVID-19 in Ontario. There are 295 people in hospital and 156 in the intensive care unit due to COVID-related critical illness. And I am sorry to say there have been another 18 deaths reported. And while 16 of these deaths occurred over 2 months ago, our thoughts are with their loved ones. We continue to see high case counts, and the doubling time of new infections is around 22 days, meaning the number of daily cases could double in that amount of time. Although cases are on the rise, the fourth wave is primarily being fueled by the unvaccinated amongst us. They account for the majority of new cases, the majority of people in hospital, and the majority of people in the intensive care units across Ontario. Recent evidence in Ontario shows that individuals who are unvaccinated are 8 times more likely to be cases than people who are unvaccinated. And when we look at those who are currently admitted into our hospitals, people who are unvaccinated are 29 times more likely to be in hospital and 48 times more likely to be a patient in the intensive care unit because of COVID infection compared with people who are vaccinated. Vaccines are safe and effective and preventing Ontarians from having to be admitted to hospital and frankly from dying from this illness. This is why you will continue to hear me and all of my colleagues calling on all eligible Ontarians who haven't yet been vaccinated to roll up their sleeves and get the shot. Already, we have had 82.3% of Ontarians aged 12 and over who have received their first dose of a COVID-19 vaccine, and we have finally reached our second dose target of 75%. Thank you to all the Ontarians who have made this important decision to be immunized. And I want to take the moment to express my deepest appreciation and gratitude to all the healthcare providers who have worked tirelessly over the last year and a half and who continue to work tirelessly to provide immunizations across Ontario. I encourage Ontarians to continue to show displays of thanks, respect, and appreciation for all of these individuals' tireless efforts to take care of us and to prevent illness through immunization. Now that our initial targets, which were against the Alpha strain, have been reached, we should aim for higher against Delta. The Delta variant is proving to be a formidable and aggressive adversary, so we must do all we can to increase vaccine uptake across the province. I know there are some individuals who remain hesitant. We hear your concerns, and we want to address any of your questions. I know that the relationship between COVID-19 vaccines and fertility is a worry and been tracking on social media for some time. This is something we've been monitoring, and we've consulted the Society of Obstetricians and Gynecologists of Canada. To date, we have found no evidence that points to increased risk for either male or female fertility following vaccination. And we've been paying very close attention to Ontario data from the Better Outcomes Registry and Network called BORN, which shows that almost 40,000 women in Ontario have been vaccinated during pregnancy. There's been no evidence of increased risk to the health of the mother or infant from vaccination. These findings are consistent with evidence from other jurisdictions that show vaccination in pregnancy is safe and effective. So I encourage couples or individuals planning to conceive who are pregnant to get vaccinated. Also, to parents with young children, we've been following the data, and I'm asking that you also be vaccinated. Parents of young children apparently have a lower immunization rate. Our youngest Ontarians, those 11 and younger, don't have a choice. There's no vaccine available to them yet. And it's our collective responsibility to protect them, surround them with those that are vaccinated. We call that concept cocooning, to provide immunity and protection to these children. This is one of the best ways to protect them. So if you're a parent of younger children, please consider getting vaccinated. If you have any questions, any hesitancy, please address them with your pharmacist, your nurse practitioner, or your physician. They're ready to answer your questions. I'm also continuing my appeal to the 18 to 29 year age group. Currently, 73.9% have received their first dose, and only 62.6% are fully immunized with 2 doses. We really need to get these rates higher. This age group is very social, and this is where the virus needs to survive when we're in close spaces and close faces. There have been several outbreaks in locations where this age group typically gathers. I know we all want our economy to get back on track and to prevent our restaurants and nightclubs from becoming sources of infection. And we all want them to stay open. So please take a few minutes out of your day to get your shot and join the ranks of the vaccinated. Although we've reached our vaccine targets of 80 and 75, these were our initial targets against alpha strain. We're still sadly not at a point where we can fully exit the roadmap to reopen. Since the beginning of March, 41.6% of our COVID cases are 29 years of age or younger. And over 73% of cases are 49 years of age or younger. Hospitalization and ICU admissions have also shifted to younger age groups. Cumulatively, 27.6% of our hospitalizations are under 50 years of age. This is not just a disease that impacts the elderly. They are actually the most protected now, with the highest rates of immunization. We need now for all Ontarians to come forward who are eligible to get protected. The good news is that the confidence in the vaccines has continued to improve over the last several months. Every person vaccinated, we are showing that these vaccines are safe and effective and prevent hospitalizations, prevent you needing to be in the intensive care unit, and prevent death. So let's continue to break down hesitancy with open and frank discussions amongst families, amongst friends, and amongst professionals. The more people vaccinated will protect our communities and help us keep Ontario open and get back to the activities that we all miss. And with that, I'll turn it over to the media for any questions.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
Your first question comes from Randy Rath from CHCH-TV. Randy, please go ahead.
Hi, Doctor. Thanks for taking my question. We're seeing increasing numbers of fully vaccinated people ending up in the hospital, and I'm wondering why that phenomena is taking place. Is the Delta variant that virulent that it's defeating the vaccines? Are these people that are ending up in the hospital of poor health? Are they among the older people in our society that have multiple health problems? Why are we seeing this?
Oh, so thanks very much, Randy. It's a great question. As more and more Ontarians are immunized, so over 10 million of us, the unvaccinated are a much smaller number, around 2.2 million that are eligible to be immunized. So when you look at overall infection rates, you'll see that at sometimes a significant number of vaccinated people will get the illness, but they will have less severe symptoms, less risk of hospitalization, less risk of being admitted to the ICU, and less risk of death. And so we may see relatively, because more of us are immunized, an increase in breakthrough cases. But the biggest risk is to those that are not vaccinated at present. Your risk is 8 times higher of getting the disease compared to someone who's vaccinated, and much, much higher on being admitted to the hospital, or the intensive care unit, or sadly of dying from this disease. So it's a relative risk that we're going to have to start discussing now. But vaccines are safe. They are highly protective. And from the data that we've got from the UK, some of the largest population studies, the protection against Delta, 2 doses, 14 days, is still in the mid 80s, which is very, very good. You're otherwise playing roulette by not getting vaccinated, with Delta being so aggressive and wanting to spread so rapidly across Ontario.
Follow-up?
Okay, it sounds like you're talking about living with risk. Does that mean that we're going to accept in our society going forward, and we're going to have to start to live with it much like we do influenza, and we're going to have to start getting booster shots to against the variants that have not yet developed, that are going to be coming in the year coming forward, because there's so many people around the world that aren't vaccinated?
Yeah, you're right, Randy. It really is starting to live with risk. The big premise, though, is as a community of caring Ontarians working together, the higher we build our population immunity, and that's somewhere over 90%, the less this virus will be able to spread amongst vaccinated and unvaccinated. That's why, as a community in Ontario, we should try to achieve our highest protection through immunization that we can. That will protect all of us, not just individuals, but we'll get a community protection. And by that means the virus won't have a chance to mutate, because there'll be fewer opportunities to mutate within Ontario. Then our strategy is to prevent mutations coming in through our international borders, and have very good surveillance for returning travelers or visitors to our country. You're right. Once you leave this country, your risk may go up to get exposed to a new variant anywhere around the globe. But our strategy in Ontario, if we want to get back
Your next question comes from Rob Ferguson from the Toronto Star. Rob, please go ahead.
Hi, Doctor. A moment ago, you said we need to get to at least 90% vaccination level for, to get past the waves and whatnot. The business community is wondering what number you would say we need to get to lift the further capacity restrictions. I don't know if you have a number, but would 90% be in the ballpark, or would it have to be even higher to lift capacity limits in restaurants, gyms, theaters, and the other capacity limits?
So really good question, and I appreciate it. The 90% I mentioned is an aspirational goal that our communities should try to achieve, at least that. I don't think it should be a measure by which we can hold businesses back. I'm very supportive that many of these businesses have adopted immunization strategies for their businesses, in particular for the Ontario Hockey League that's embraced. If you're going to watch an Ontario Hockey League game in any one of the communities in Ontario, you should be immunized to go there. I would think that the government should assess that, and if everyone in that environment's immunized, that's a very low risk event, and I would hope that the government would make a decision to enable them to move forward, even if we have other restrictions in place. The same should be true for other venues, like going to a professional hockey game or basketball game or baseball game. Many of them are stepping up, embracing immunization policies. And I do think the government will look very favorably on that and not hold them back in any restriction. But that would be a government decision. The 90% is an aspirational goal. Many communities are starting to achieve that. Or knocking on that door. And I can call them out, like Leeds Grenville Lanark, and Ottawa's doing brilliantly, Waterloo, Thunder Bay. Many communities are achieving very high levels of immunity through immunization. I think that should be celebrated. They're doing wonderfully. And certainly our last mile strategy across Ontario is to enable us all in all communities of Ontario to try to get there with the highest level of protection. The decision to open businesses would be a separate one of government, but I'm very, very supportive of these policies that these businesses are adopting to best protect their workers, as well as those that are coming into their venues.
Follow up?
Yes, thanks, Doctor. So I think you're talking there about businesses and venues and whatnot requiring proof of vaccination, which makes me wonder why last week you said you were not in favor of a proof of a vaccination certificate system. It sounds like you want the private sector to do it, and telling us that is the gateway to lifting capacity limits. Why doesn't the province just do it?
Oh, I'm sorry if you misinterpreted me. We have a proof of vaccination. You can download it off COVAX. You can put it as a PDF or print it out. That's your first and second doses, plus 14 days. We're also working with the federal government. As you know, they've announced that they'd like to have a vaccine passport for international travel. And the federal government's working diligently with all of our international partners to ensure that our mixed schedule will be acceptable. And I do think it will, especially in Europe, where the vast majority of countries have a very similar schedule to us. So that's looking very, very favorably. And that international passport, vaccine passport, could be used domestically. So we are looking at those options, and certainly very supportive of having a rapid means of showing your vaccination status to enable you to get into certain venues. So I think that work's getting done in partnership with our federal government, as well as with local businesses.
Next question.
Your next question comes from John McGrath from TVO. John, please go ahead.
Good afternoon, Dr. Moore. You said last week that, pardon me, the changes in policies announced last week were due to a recent drop-off in vaccinations. And I was hoping you could clarify that, because there really wasn't a recent drop-off. The first doses started dropping off very rapidly in May and were down more than half by Canada Day. second doses had also been dropping for weeks before you announced the changes in policy. So I'm wondering if you could clarify. I mean, why did these changes wait so long?
So we peaked on a weekly provision of doses somewhere in July at around 1,500,000 doses, and we've slowed right down to weekly around 270,000 doses, and we've lost momentum over the last 4 to 5 weeks, and at the same time, Delta has gained momentum, and we've listened to the science table. We've been monitoring projections and modeling and doubling time, and we clearly realize we need a little more momentum into the program, immunization program, and as a result, that's where we've embraced the immunization policies, and it, today we've seen a slight uptick. I do hope over the coming days, given the threat of Delta, that people will embrace immunization, and with the added incentive that some businesses won't let you in unless you're immunized or tested, such as a professional hockey, basketball, baseball game, soccer game, or OHL game. So I think there's multiple more incentives now to get immunized and get protected, especially in the face of the rising Delta numbers.
Follow-up?
There has been a slight uptick in terms of the 12 to 17 group who had their eligibility expanded, but for weeks now you've been using your your pulpit to try and persuade people to get vaccinated, and the average keeps falling. I'm wondering, is there a point on the calendar, September 1st, October 1st, whatever, where if this continues, you will say that persuasion is no longer enough and more coercive policies might be needed?
Well, I think you'll see relative to other provinces that we've been embracing immunization policy very strongly, both in the hospital sector, the chronic care sector, in now moving to shelters. And we'll be working with our public health agencies who would like immunization policies for their workforce. Ontario's embraced immunization policy very aggressively. We're also working with our education partners, colleges and universities. We've done a risk assessment, and we prioritized the areas where we thought we should have the best protection and highest priorities sectors. And that policy, I do believe, is working. I've spoken to the University Health Network leadership, and they have increased the protection of their workers against COVID-19. And I've been in discussions with multiple other hospital sectors and cancer institutions that have embraced policies. So I'm happy. But you're going to find the last 14% is very slow and steady. And that's why we called it the last mile. It's the last mile of a very long marathon. And we know we have to answer questions for these individuals. That's going to take longer. We want them to build their confidence in the immunization. The early adopters have all been immunized. And now we're left with, I would think, the last 14%, which will be the most difficult and take us the longest. But we'll be patient with them and building incentives for them, as well as policies around them to best protect the vulnerable in our communities.
Last question.
Your last question comes from Paolo Lorigio from the Canadian Press. Please go ahead.
Hi, I want to circle back to one of the questions I believe that Rob was asking. A lot of private sector businesses are saying that in the absence of a provincial policy on proof of vaccination specifically, like requesting it and having people provide it and so on, they've been kind of left to come up with a system for themselves and facing a lot of backlash at times. So do you think it would be helpful to have provincial guidelines and guidance for businesses to kind of set up their own protocols around that?
Yeah, I can tell you we're working diligently with our federal government on having a vaccine passport that can be working internationally as well as potentially can be used domestically. Anyone can also make a PDF of their documents from COVAX. First and second pages, that's a start in the documentation process. I think that's what BC is using. Very simple technology that you can have on your phone, a full, PDF copy. And we're looking at recommendations from businesses on how to help them verify. So this work's getting done in the background, and we want this immunization strategy to succeed.
Follow up, and this is the last question.
Okay, you've said previously that the province was reviewing the possibility of adding COVID vaccine to required immunizations for students, but school is starting pretty soon, and considering that we need 2 weeks after the second shot to have it be fully effective, when will a decision on whether or not that will be added be made, and will it be in time to actually provide any kind of meaningful protection for students as they head back to class?
So I have to celebrate the immunization rates we have right now in our high schools. If you compare us to any other jurisdiction, we're at roughly 75% of grade 9, 10, 11, and 12 that have had their first doses, and the second doses are quickly following up behind them. So we've had a very successful immunization strategy without any other action required. I do think it's of interest of public health to understand who has been vaccinated and not, in case there's activity levels within a school setting. So we're working between public health, local school boards, and the Ministry of Education to ensure that we have that type of understanding of who's been vaccinated or not. The means by which we get that information is under active consideration, and we've been working all weekend, every day, with our partners to try to come to a solution on that.
Thank you, everyone.